Deputy Speaker. This bill opens the NHS up to big business, allowing private companies a say in the care that patients can receive. The Government's amendment to the make-up of integrated care boards is weak, and it fails to rule out the possibility of people with interest in private health from sitting on them. For this reason, I have tabled Amendment 101, which seeks to ensure that ICBs are made up wholly of representatives from public sector organisations, and that private companies, their employees and representatives, and those with financial interests in them, are not represented on them. Surely this is what the public expects from a body that will be responsible for spending huge amounts of public money. But the influence of private companies isn't just an issue with ICBs. The bill allows for private companies to play parts in other ways. For example, a subsystem level via place-based partnerships and provider collaboratives. Guidance by NHS, even though they're not actually stated in the bill, but that's what it means. Guidance by NHS England states very clearly that the Health and Care Bill, if enacted, will enable ICBs to delegate functions to providers, including, for example, devolving budgets to provider collaboratives. There's nothing to stop such partnerships from being open to big business, so the Government's rhetoric around protecting independence of ICBs is frankly quite meaningless, and for all of their talk of recognising that the involvement of the private sector in all its forms in ICBs is a matter of significant concern to members of the House, they haven't actually taken the action needed to stop private companies from influencing decision-making. And that is why I've put forward Amendment 58, which is designed to ensure that any organisation carrying out the functions of an ICB on its behalf is a statutory NHS body. While the Government has made some noise about private membership of integrated care boards, when it comes to integrated care partnerships, they have said that they want to, quote, want local areas to be able to appoint members as they think appropriate. This, too, is a matter of great concerns. ICPs are required to prepare a strategy setting out how the assessed needs in relation to its area are to be met, and integrated care boards must have regard to this strategy. And so we see ICBs will need to have regard to a strategy drawn up by the ICP, which may well be influenced by private companies who do not have the same objectives as the NHS. That's why I tabled Amendment 100, which does for ICPs what my Amendment 101 does for ICBs, namely seeks to ensure that integrated care partnerships are made up wholly of representatives from public sector organisations and that private companies are not represented on them. The bill breaks the NHS up into 42 integrated care systems. My Amendment 59 is designed to ensure that any providers of health service cannot withhold provision of those services from any individual because of the integrated care board that they've been allocated to. In other words, that wherever someone falls ill in England, they can get treated. There have been alarming reports recently of people who are in need of urgent care being turned away from A&E because they presented at an A&E centre which wasn't closest to where they live. This is extraordinary and not what we expect of the National Health Service. One recent report told of a woman who suffered burns when she attended A&E, only to be told that the hospital didn't treat people from Rochdale. There is nothing in the bill to ensure that people in the country can go to any A&E in the country if they need to. So my amendment is designed to address this shortcoming. The bill also, as we know, is one about enabling privatisation, and when we look at the procurement reforms in the bill, we can see why. They will enable the removal of the current procurement rules which apply for NHS and public health service commissioners when arranging clinical healthcare services. The bill provides the power to create a separate procurement regime for these services, which will include removing the procurement of healthcare services for the purposes of the health service from scope of the Public Contracts Regulation 2015. I will indeed.
I'm grateful to my honourable friend. Does my honourable friend agree with me that this has the sense of an NHS corporate takeover bill? We've already seen, because of the private sector, £5 billion in contracts awarded to private companies through the VIP lane. And this bill opens the door to private corporations to sit on 42 local health boards, and this is wrong.
I thank my honourable friend for putting the case so clearly. She's absolutely right. She hits the nail absolutely on the head. As a result of the arrangements in this bill, contracts could be handed out to the private sector without the stringent arrangements one would expect in the awarding of public money. This is a recipe for cronyism, the kind that has become all too familiar, as my honourable friend has just talked about. And now I'd like to turn to the issue of cap on care costs. I was proud to stand on a manifesto in 2019 that pledged to build a comprehensive national care service for England to include free personal care, beginning with investments to ensure that older people have their personal care needs met, with the ambition to extend this provision to all working-age adults. The Conservative manifesto in 2019 didn't go that far, but it did at least make the guarantee that nobody needing care would have to sell their home to pay for it. We now know that that was a sham, another broken promise by this government. Last week, ministers snuck out changes to social care plans which would mean poorer pensioners would not, after all, be able to count means-tested payments by the state of their care towards a total cap of £86,000 for any individual. The chair of the Health and Social Care Select Committee described it as deeply disappointing that the new plans were not as progressive as those put forward by Andrew Dilnot, the economist who drew up the original plans for a cap on individual contributions. Mr Dilnot has said that the government's plan was a big change and that it finds savings exclusively from the less well-off group. A former Conservative Cabinet Minister has urged the government to adopt a different approach. Another Conservative MP, a former Under-Secretary of State for Health Services, has said that it will be poorer pensioners who have relatively modest assets that will be most affected by these changes. So I hope that the members on the government benches listen to these points from their own side, not just from us on this side, and that they do the right thing. Elderly people deserve better, and all members, including those opposite, have a responsibility to vote these measures down. When the Prime Minister was discharged from hospital in April 2020, having spent 7 nights there, 3 of those in intensive care, he said, "The NHS has saved my life, now question." Now he and his government should save the NHS by withdrawing this health and care bill. The National Health Service is this country's finest social achievement, and it is devastating that this Conservative government is intent on taking it off us.